The Cincinnati Fetal Center is one of only a few comprehensive fetal care centers in the world. Led by physicians from Cincinnati Children's, Good Samaritan Hospital, and University of Cincinnati Medical Center, the team specializes in treating complex and rare fetal conditions. One of the treated disorders that can develop during pregnancy is called bladder outlet obstruction. Doctors typically diagnose this fetal disorder in the second trimester during an ultrasound.
The lower urinary tract obstruction is usually visible easily by ultrasound in that the bladder looks very big. You'll see that as a large cystic fluid collection in the baby's abdomen, and the amniotic fluid volume around the baby is very low.
While in the womb, a baby needs to have amniotic fluid around them for their lungs to develop. Normally, their urine would empty out into the amniotic sac and become part of the amniotic fluid. But when there is a blockage in their urethra, the urine can't make its way to the amniotic sac. Instead, it gets backed up in the baby's bladder and kidneys. This causes the bladder to enlarge and the amount of amniotic fluid to decrease.
The biggest problem when a baby is diagnosed with bladder outlet obstruction is the worry of no fluid accumulating around the baby to allow the lung to grow normally and healthily.
To help parents decide the best course of treatment for their baby, a team of specialists with extensive experience and expertise takes the time to meet and explain the latest treatment options before and after birth.
This is truly personalized medicine at its best. So every family gets a highly personalized, crafted care plan that is made just for them.
The specialists include physicians from maternal fetal medicine, pediatric surgery, urology, nephrology, transplant, and neonatology. A nurse coordinator and social worker are assigned to each family to provide support every step of the way.
We want to have everyone at the table presenting the information so that by the end of the day, the family really has an understanding of not only what the diagnosis is, but what it means for the baby, what it means for mom and her pregnancy, and then ultimately what it means for the family going forward.
For the last 10 years, physicians at the Cincinnati Fetal Center have evaluated more than 240 patients for bladder outlet obstruction. There are a variety of treatments, and the fetal care team can explain surgical options in detail.
Surgery would not be a complete cure. It's definitely a process, but because of the multidisciplinary care that we are able to provide to this high-risk patient population and have a good long-term follow-up plan for this family, we can certainly protect what is there.
Following delivery, babies with bladder outlet obstruction are transferred to the neonatal intensive care unit. There, neonatologists, urologists, and nephrologists review the baby's condition and consider the next steps.
The thing that we worry about first is whether or not their lungs have grown appropriately in utero. And you never know that for sure until the baby comes out, starts to breathe, and we monitor how they do.
Those outcomes, though, again, are improving, and not just so much in the technology and the ability to keep them healthier, but also their acceptance and the availability to provide what they need to be completely mainstreamed into the community and active and healthy and going to school and things of that nature. There's so much more available now that I would say the quality improvements are really quite dramatic.